All right, take two.
Technology.
This is Dr. Terry Cooper, and we're going to continue our talk about thyroid and autoimmune and Hashimoto's. Where we were at prior to this was in the typical medical treatment plan.
Yeah.
For thyroid issues is going to be levothyroxine, a synthroid, some kind of a T4 support. Occasionally they might come up with some T3. There are some natural thyroids. Yeah. I mean, but that's really the options that people have.
Yep.
I know I have some girlfriends, and I mean, it drives them nuts. I've gained 15 pounds, or I feel sluggish. I mean, I just feel terrible. And we had a patient come in not even more than a month ago, and I ran the extra thyroid blood test on her, and her TGB was through the roof.
Sure. And
it was, and her medical doc, for whatever reason, no fault of their own, I guess, they just don't step into that.
And they don't even inform them of really what that means, not just now, but long term, because that TGB antibody turns to cancer.
Exactly.
That is medical.
That's what I learned this weekend.
That is hardcore medical fact. I mean, that's not my opinion. This is what the research shows. That TPO antibody doesn't. That TGB antibody does. So, and they're not, the patient's not informed that.
Right.
And that's a big deal because, moving forward, obviously,
right,
you've got to make sure it's something that's handled.
And I think that's what's so important about these technologies is that we're handling them now.
Yeah.
Because you
Allows
can't
us to.
Exactly can't rob Peter to pay Paul in the future, because we know where we're going.
Sure.
And we know what kind of world we're living in. So in order to live in this world, go.
It's the rite of passage that we all have to pay now. Look, we have access to great things, but a lot of that puts strain on our system.
Yes.
And nobody wants to give those things up, me included. Obviously we talk about technologies, right? We like the way easy of technology in the world, but when you look at the numbers, 90% of the people who are diagnosed with thyroid stuff are Hashimotos. Okay, so just trying to balance their hormones, and their immune system keeps coming in and throwing them back off balance. It's got this third party, like we try to build a house of cards, and you got this third person who keeps coming in and moving the table, and everything falls. And then they're changing dosages, and they're doing that. And remember, the construct here is that the immune system is destroying that tissue.
Right.
The use of medication will expedite that process. Okay, so because it doesn't matter, as soon as your thyroid works, whether we're making it work with a medication or it's doing it on its own, the immune system doesn't know why it's doing that, so it's attacking it like it's something that shouldn't be there.
So if they're on the medication, you're saying it could actually expedite?
It expedites the process, because in the construct is your immune system is going to destroy the tissue eventually.
Okay.
So if it's in that 10 years, then when it's completely destroyed, we'll cut it out, and then we'll just replace the hormones from the outside in. So if you give them the medication and they feel quote unquote better, which nobody does, I mean, they feel somewhat better, maybe they have the honeymoon phase, but there's still stuff that's not right. But that makes them have to get the tissue cut out in 5 years. Well, what's the difference? You might as well feel better in those 5 years. You're going to get the tissue cut out anyways. For me, in my world, my head, my patients, my family, and the way I would want it done was, is there some way that we can make this work so that I don't have to get this cut out and I don't have to live on medications?
Right.
Right. That's the logical question. And now, up to the last a little bit, there wasn't a real logical answer for that, which was the problem. So now that we've been able to have these different things at our disposal, these tools, these technologies, the different ideology on nutrition, and of course, the research has come so far. American Medical Association research says that the average doctor operates 17 years behind the research, which is terrifying. Okay, so we're in 2017, right? So we just got here. So we're in 2016, 2017. That brings us to 1999, 2000. Think about cell phones, right? If there even were ones, it was beepers, right? What were those really huge ones that were like anti-mugging devices, like somebody came after you, you could whack them over the head with it? Think about the internet. It was brand spanking new.
Yeah.
So think about where we were technology-wise. So in those years, we've learned a tremendous amount, but that's not the way that most doctors are practicing.
Okay.
Because researching like that's a full-time job.
Yeah.
It's hard. It takes a lot of the time. But now that we have the research, now that we have the understanding, and now we have the tools to be able to accomplish what that research is telling us, now this doesn't become such an unmanageable thing where we actually have some solutions where in the past, that was the best we could do. And everyone's doing the best that they can.
Right. But
people need to know that there's a new best.
Well, and correct me if I'm wrong, but maybe what you're saying is that some of these technologies may seem a little bit different, unique.
Sure.
But they're going to be, I don't know, the Star Trek of the future, whatever that looks like.
Well, think of it this way. Simple problems may have simple solutions. Complicated problems, and believe you me, autoimmunity is a complicated problem. Complicated problems, just by their nature, are not going to have simple solutions. Complicated problems are going to have complicated solutions. So you need something that's a little bit able to do something more complicated. However, the nice side of it is these technologies are very simple to use, simple to go through. There's no pain, discomfort, or anything else like that. But they can accomplish something complex that we weren't able to accomplish before.
Right.
There's no pill out there that does what these can do. There's no vitamin out there that does what these can do. And truth be told, they're able to do something more complex, and that's what you need. You need complex treatment options to work with complex problems. But if now that we have them, those complex problems become a little bit more linear to help.
Can you help the people that will see this in regards to what the treatment length looks like?
Sure.
And what your success rate has been?
Sure. So, in a typical length of times, we usually see it takes about 6 months or so to get something like that either completely reversed, meaning no more antibodies, normal thyroid function, where the body will heal it, or where you can get somebody, but the other 20% will go into complete remission.
So, and why is it 6 months?
The 6-month ideology is based off of scientific fact. It takes our cells about 90 days to regenerate themselves in a more healthy manner.
Okay.
So we typically find it takes 2 cell cycles, sometimes a third, but two cell cycles in order to get enough cellular repair done to where your immune system now looks at that thyroid and says, you know what? You are part of us. You're not some foreign invader that we need to destroy. You are part of us. We love you all the same. We're going to now not attack you anymore. And then that allows you to your body to balance out those scales. And that's what the technology allows us to do, is to really balance the immune system. So truth be told is I've never fixed anybody or anything, but I have more advanced ways now of giving the body what it needs, so it's allowing to balance that teeter-totter in a sense. Again, back to what we always say. What do we say?
Power of the body.
Power made the body, heals the body.
And we love that part.
We're just acting as intermediaries now, and technology has become an intermediary thing of being able to kind of remove those blockages, give the body back some of the energy that it needs, so that once it has all its resources, your body knows best how to heal you. It's just our job to
even more than us.
A lot more than us, way more than us. Why I say never fixed anything, but where we come in is being able to give the body what it needs, and then just kind of help coordinate that so we can do it in the most efficient timeline.
So about 6 months, they will find.
We'll see the thyroid patterns being normal, the hormone levels being normal, and potentially antibodies being lowered or hopefully gone. But even if they're not, the immune system is balanced. There's no attack.
Okay.
But the immune system is still kind of watching that system, saying, I got my eyes on you.
And most often, many of these people can work with their physicians and be off of some of the medications as well.
Yeah, no, obviously we always want them to go back, check in with their doctors, because I think it's important people have a team.
Absolutely.
A team of people looking at them and everyone working together for this common goal of what you want. Do you want to be off of this? Do you want to feel better? Do you want this to not have to be removed surgically somewhere down the road?
Right.
But yeah, we can work right back in between there. And the greatest part for the person is they're safe in the future. There's no more conversations of thyroid cancer. For me, that's obviously a big deal. Right. But for the patient in that moment is they feel worlds better. They feel worlds better. That weight's come off. That they're able to lose it now. Your metabolism's actually working with you. What a concept! Rather than willpower is totally overrated, right? It's a lot easier to lose weight when your metabolism is actually working on your side than not. But then again, the energy's back, the weight's coming off, all of those symptoms that go along with thyroid, because thyroid symptoms are real similar to, there's stuff that people blame on just getting older.
Right.
Oh, I'm more tired, I'm not sleeping as well, and my hair is getting falling out, all these different types of things, but that's just, I'm under a lot of stress, it's age. Age is just an accumulation of time for all this stuff to build up, but we need to be back in the driver's seat so that our body heals the way it's supposed to.
You're such a gift. Thank you.
My pleasure.
I'm just so glad. Thank you, everybody, for listening. Appreciate your time.